It's such a pleasure to be here. And like Daniel mentioned, the last time Chris, Lillie, Daniel, and I were all together was an incredible moment for me personally and professionally. And I'm so glad that we're back together again to have a very important conversation, a conversation that's very much needed in a nation that has transgressions against other. I think that's the best way to say it, against other, in terms of race, in terms of economic status, and so forth. So I'm looking forward to our conversation. You know, I heard a quote recently that I thought had a lot to do with the conversation that we would have today. And that is, fear is a reaction and courage is a choice. I think when we talk about diversity and we talk about coming together as a community, there are so many words that we use to describe things, and sometimes we don't have the right words to use. And so sometimes that keeps people quiet. I think having this conversation shows courage on Lillie's part. It shows courage on Chris's part as individuals and as representations of their organizations. Before we go into the conversation, I just wanted to refer to that in healthcare, entire fields of study, like the field of gynecology, were built on the backs of Black Americans being exploited and experimented on by the medical system. And Tuskegee and the syphilis study is at the cornerstone of that story. But we talk about words, Lillie, when I first started, we talk about the importance of words. And you cautioned us about how we want to refer to this study. So could you give us more background and tell us how we should refer correctly to the syphilis study?
Thank you so much, Pamela. It is great to be here and to see all of you. And Chris, thank you for inviting me to this conversation, because I feel that it is very important. The original name of the study was a Tuskegee study of untreated syphilis in the Negro male. And at the beginning, by naming it Tuskegee study, it put the ownership on Tuskegee, as if Tuskegee were the ones who were doing the study, responsible for the study, accountable for the study. And that should not have been from the very beginning. And as the foundation is transforming that legacy from shame and trauma to triumph and honor, we are beginning with the name of the study by making the name right. And now the study was done in Tuskegee, but the study's name should have been, from the very beginning, United States Public Health Service study of untreated syphilis in the Negro male. The men were trusting. They were told that they had this bad blood, and they went forth thinking that they would be treated. And as we know, they were never treated for their bad blood, but still trusting over 40 years. And that is at the core of the study, is that the men were trusting men, but never treated. And I think that's where we can look at one example of how African Americans have the feeling and the mistrust for medication, vaccines, and so forth, especially when it's done or sponsored by the government. Because the doctors who performed the study and who originated the study were public health officials from the United States. So words have meaning. And if you put Tuskegee in front of that, it's a misconception. And it brings shame not only on the men, but also on the city of Tuskegee or the town of Tuskegee, as well as Macon County. And the other reason why the Tuskegee syphilis study or Tuskegee experiment should not be used is because we know of another Tuskegee experiment, and that is with the Tuskegee Airmen. And I have heard people confused the Tuskegee syphilis study with the Tuskegee Airmen, and the two are nowhere connected. So it's important that we use the correct thing, United States Public Health Service syphilis study.
Thank you. That's really important. That's
Yes.
important. And Chris, in terms of your experience as the head of the Milbank Memorial Fund, and having all of the things that have kind of uncovered the history of the organization and its work in this regard, tell me what it's like to discover, first of all, tell me what it's like to discover that, and talk to me a little bit about, you had mentioned in our earlier conversation, it took you a while to decide that the apology is what you wanted to do. I'd like to hear more about that, if you could share that with us.
Sure. Thank you, Pamela, and thank you to you and the team at ABIMF for creating this opportunity to have this discussion today and around this important theme of rebuilding trustworthy healthcare systems. So I want to, just as Lillie has covered some of the facts, I want to make sure everyone listening has the facts about our involvement, just so that we have we start from a common place. So to be clear, 2 years after this study of untreated syphilis, the U.S. Public Health Service study of untreated syphilis was started, leadership of the Milbank Memorial Fund was approached in 1934 to ask if we could help fund a portion of the study. And specifically what we were asked to do was to pay for the burials of men who died in the course of the study. There were not funds available for that, and they thought, the leaders of the study thought that that would help actually keep men in the study. For the leadership of the fund at the time said yes, we have some ideas as to why they said yes, but to be clear, as part of to be utterly transparent, the funds were only made available for the burials if the families consented to autopsies. So you can add one more indignity to the list that Lillie was speaking about. We said yes. We were not involved in the design of the study, the execution, but our research says that we had numerous opportunities to withdraw from the study, and we never did until the study was concluded. So in effect, we would get a bill, an invoice from the U.S. Public Health Service to pay for the burial fees and other services for men who died in the course of the study. We would write that check. When the study was concluded, our participation ended, and that involvement has been documented. It was public knowledge. It was written up in histories. To the point that you asked, Pamela, I became aware of this personally about 4 or 5 years ago. I thought it was, I'm going to use a very honest term, unfortunate. I cringed, but I didn't do anything about it at the time. And I think that's part of, frankly, I would say that's the benefit that I had. And Lillie and I have talked about this compared to someone who was in the study or an African-American in general. I could turn away and say, that's really unfortunate, and just sort of leave it in the closet. Fast forward to 2020, in the wake of the national reckoning around racism and racial oppression, we were going through our own diversity, equity, and inclusion exercise internally. And this fact became more apparent. So the people who knew about it on the team talked about it with the folks who didn't. And there was a sense that things had changed. Things had changed in nationally, they had changed in our organization, and they changed in me personally, so that I could no longer turn my back on it, if you will, and we couldn't turn our back on it. So we brought it to the attention of the board. Some of the board members knew about it, some did not. There was a very full board discussion. And at the time, the board collectively made a decision to prioritize this notion of a public apology to the people most directly affected by it. And I would say fortunately, or thanks to the leadership of Lillie and her colleagues, there was such an organization, Voices for Our Father's Legacy Foundation. And after much internal reflection about the consequences of this and the stakes, one day in September, I just picked up the phone and called Lillie and introduced myself, explained our role, and apologized. And we can talk about what that exchange was like, but that really was the beginning of our relationship and this whole process. Since then, we delivered a formal written apology to the board. We met with members of the board and members of the organization. At the request of the leadership of the board, including Lillie, really a high point of this was a formal public apology ceremony at Tuskegee University the second weekend in June of this year. So the process will continue. In addition to this public apology, as you know, we've made a financial contribution to Voices for Our Fathers. We also commissioned a history, which is available on our website by the person who literally wrote the book about the U.S. Public Health Service study of untreated syphilis. And we've committed to implement governance reforms to ensure that something like this doesn't happen again, based on the understandings of how we got to this place. So we view this discussion that we're having today as very much part of that journey that we're traveling in our partnership with Voices to talk about this process. And maybe what I will end with is this. I think this process that we're embarking on now begins with a personal connection and relationship between the leadership of Voices, Lillie, and myself. Trust starts with a set of personal relationships, and Lillie had to trust me, and I had to earn that trust. And I don't say that she had to earn my trust, but I had to demonstrate to her that we were serious. And that means just simple things like following up on phone calls, delivering emails, doing what you say you're going to do, and then the organization doing that as well. And that's, since we're talking about trust, that's how you build trust in one another. Thank you.
Thank you, Chris. The fact that you do have an organization to come to give an apology is in no small way part of Lillie's story about her father saying that, you have to make sure that this doesn't happen again, which is why there is the organization, a Voices organization. Can you talk a little bit about your father's legacy, about making sure that this doesn't happen again, and why it was so important for you to take on this responsibility?
Of course. And I'd like to make clear that when I speak of my father, I am also embodying all of the men who were in the study, all 623 men that were in the study, some of whom I knew personally. And then in addition to my father, I had a great uncle and cousins that were in the study. So it's not about my father, but it's about all of the men and their families that I am referring to. And I think because the men were so trusting, and because of their integrity and their character, it's important that they be represented and be spoken of in the best form. Also, at this time when we're talking about trust, or distrust in the medical system, it didn't just start with the study at Tuskegee. It began from the very beginning, and there was a lot of theories that went into, and ideas that went into how Blacks were treated and how Blacks were regarded as subhuman. And eugenics played a role in it. Now is the time for that to change. Because it shouldn't be. And sometimes I think it's practiced unknowingly because of the practices have been embedded in the system for so long, as far as how one is treated, that might be different from you, or might come from a different culture than you. And we need to change that. We need to change that that attitude about how you treat. And I think, Pamela, you mentioned other at the very beginning. How do you treat other? I also would like to emphasize that if we start from the standpoint of humanity and each person being a human being and treating that person with dignity, respect, and honesty, we will begin at a very significant starting point. So my father, speaking of my father was a very proud man, very honest, very conscious of his health, and very particular about his appearance, his weight, and his exercise, and a man of wisdom. He wasn't formally educated, but he was self-educated, as were so many of the men. They had to be educated in a way and in a position to survive the racism in Jim Crow territory in Alabama during that time. I mean, they did the best they could for themselves and for their families. But my father was a proud man, and he was an honest man and a man of character and integrity. So when I became more involved in learning more about the study, and the opportunity came forth for voices to be formed, I believed in the vision that the descendants and had when we started the organization, was to bring honor to the men, which had not been brought to the men at this time. If they were only left as guinea pigs, used as guinea pigs in the labs, poor, uneducated, less than, and we knew that that was not the men. They were more than that, and they should have been treated with more than that. So when we had the opportunity to organize and to come forth with changing that legacy, and by telling the truth about the study and clearing up some misconceptions about the study, we felt that it was our duty and responsibility as their descendants to speak forth.
Thank you, Lillie. And Chris, you talked about, I just picked up the phone one day. But I'm sure that, of course, with the organization, there was a lot of conversation about what you should do. What was going on in your own mind about picking up the phone, calling essentially a stranger? And what were you trying to accomplish? What can an apology accomplish, do you think? And what were you hoping to build with Lillie and her organization?
Well, that's an underestimate to say that there were internal conversations beforehand, Pamela. I think there was a strong desire to correct what was wrong, what we did with, to correct the wrong actions that we did, and a real genuine concern about how to go about it, and particularly the timing. We had a range of opinions on the board that ran from, we should have apologized yesterday, to we need to find out every possible fact about this so that we're ready to answer anything that could come over the transom. And so part of what we had to do was to find what is the appropriate ground. And we were given advice from external consultants. Focus on your program. Don't focus on the apology. That was a long time ago. And we thought, no, this is to make things right. You have to acknowledge that you did something wrong. You can't just move past that. But on the timing thing, I remember a very clear conversation. I was talking to a friend of mine who's also a former public official like myself and been a state official. And at the end, he said, Chris, what do you think the right thing to do is? And I said, I got to pick up the phone and call. And he said, well, okay. And that was sort of having a partner who'd been in a hot seat and was reflecting on it. And we did our due diligence. We read a lot about Voices beforehand. They had taken some very public leadership positions around COVID vaccination, some very powerful public service announcements that include people to look up. And so I had kind of an inkling that not only that this was the right thing to do, but this was an organization that would accept the apology. I didn't expect them to say thank you. I think that there is real harm here, and there's a danger, I think, for our institution to kind of go past that. I mean, we've really got to dwell on the legacy of something like this. Pamela, the conversation we had at the start, and you have to move. What do they say? It's true of a lot of things. It moves at the speed of trust, and so and the onus was on us. It wasn't on Voices. The onus was on us. We had to take that step, and I'm grateful for the work that we did, the leadership of the board, that we could pick up the phone and make the call.
So Chris, at the end of the day, you could do the apology, but and as Daniel shared, it took courage. There's no question. But I also think on Lillie's part, there's a lot of courage in the acceptance, in the grace of having the conversation, thinking of the harm that was done and the legacy. And I'd like to get to Lillie in a second on that. But one of the things that I think about with apology is that people do not have to accept your apology and what that could mean to Milbank. So when I saw the line on your website, it spoke about what actually happened, which was there was a burial payment for burial of your loved one, but you had to agree to an autopsy. And that piece, that line brought me to tears more than any line that was on your website, because I remember being a kid, and my family is from North Carolina. And I remember as a kid sitting in the room with my aunts and uncles, my great aunts and uncles, and having them talk about autopsies, having them talk about don't let them open you up. And all of the things that I heard about the dangling of the burial, the autopsy, it feels like I heard that while I was growing up. And that really kind of built, people's concerns about engaging with the medical community and the legacy of all of those things. I mean, men and women were also involved. It wasn't just the men who went untreated, but they never, as I understood, they never could get treated as a part of the study. Is that true, Lillie? Like that they could not, to be a part of that study meant they could not get the penicillin. And Chris or Lillie, either one of you could speak on that a little bit, because the legacy is large, the distrust is large. And as I said earlier, it's the cornerstone of distrust that African Americans have with the medical community.
The men were not allowed, if they remained within the study, to get treated. If they left the study, like my father, they received treatment. And they were also followed when they left Macon County to go to other parts of the country. There was a list that had circulated about, with their names on it, as to that they were involved in the study and not to receive the penicillin. And they didn't know that this had happened. Some of the men were informed from some, I don't know from whom and how they learned, or maybe their own suspicions about certain things, and they sought help from someone else. My father, because of my grandmother, who was a midwife and was working with one of the white doctors there in Macon County and delivering the babies, she told my father to stop going to be to be tested or to give his blood, and to go and see the doctor that she was working with. I don't know the date, because that was before I was born, and my father, when we talked about it, could not remember that, nor my mother. So some of the men were, I would say, lucky enough to escape that. And then there were some who were not lucky enough. Now, when the study ended, 100 men had died from complications from syphilis, as well as direct result of syphilis in 1972. So that was, that was significant in and of itself. And then you had the men who were not untreated, but the men who did not have syphilis, who was in the control group. Unfortunately, some of those men got syphilis, and they were switched over to the syphilitic group, which was there. But they were never told out of the 40 years that they had syphilis and that they were not being treated. And they were told when they went to the doctors for this, that they would be treated. And even with the, I would say, archaic medication that was given to them, the arsenic and mercury, they were not given that. But they would still do the test on to see how syphilis was progressing with their bodies. And then you have the 40 years of those men who were in the study where they continued to take the blood test and what was learned and gathered from the blood test. This is still not known. And this will help to build trust once we find out about what happened to those samples and what was learned from those samples, as well as the biospecimens that they took from the men upon their deaths. How were they used? Where are they? What was the significance of that? So it's I think there's a lot to still be learned from that study, because there's so many levels to it that could really help to bring about trust in the system.
Thank you, Lillie. When we talk about the syphilis study overall, it's very large. It's 623 men were involved. Some 40 women also, and women that we know of actually got syphilis and passed it on to their children as well. So it looms large in the African-American community and in other communities as well. The part with Milbank in terms of the burial services, and Chris, as you were thinking about and the apology and having your consultants and your communications people around the table having this conversation, can you share with us what you think the most important line or the most important piece of that apology that you thought, that you felt good about, that you felt comfortable with, and you thought it was the right thing to do? Was there a part of that apology about the note, about the message that you were proud of in a moment of a lot of humility and not great news, right, from your organization? What really mattered to you in that apology?
That what mattered was that we could finally come clean. We had this part of ourselves that we weren't living up to, and as we started to speak to people about this before we put the announcement on our website, we wanted to talk to some people with whom we have relationships with. It was really humbling, Pamela, particularly talking to Black colleagues and understanding the variety of, and not understanding, appreciating, experiencing the variety of reactions that range from, I have to stop, we can't go on, I need to sort of dwell in this for a moment because of the legacy of what you were speaking to. And then other folks who would say, surprised, not surprised. I'm surprised, but I'm not surprised. Welcome to my world. What are you going to do about it? And I think for us, what was, I don't know that I would say I was proud of it, but what was the privilege was being exposed to what it must be like for you to sit in those living rooms and hear those conversations. I, as a white person, am not part of that. I don't have that cultural distrust because of events like this. And so the privilege of being admitted into your world, it as a white person, it leaves you changed. And so I know I hesitate to say that I'm proud of that, but it certainly is a privilege. I think maybe, and this might be where you're going some of this conversation, but I would say at the public apology ceremony, what I was proud was that voices in Milbank might be setting an example for others of how you build a relationship, acknowledge the harm. You don't move past it. Harm is part of life, but so is the potential for healing and for moving forward. And you know, Lillie, you heard me say this, but standing under that tent in Tuskegee, seeing Lift Every Voice and saying, I'm not going to forget that. That's what the future can be. I have to say, thank you for that.
And Lillie, you talked about humanity a lot the last time we spoke, and you spoke about humanity today. When you heard from Chris, a white male at the Milbank Memorial Fund, what were your first thoughts? He's calling me. What were your first thoughts when you heard from Chris? And the fact that he was a white male from an organization that you understood what that organization had been involved in. What was it like for you? Because you're responsible not just to your own family's legacy, but to the legacy of all the men involved in the study. What was your first thought when you heard from Chris? Honestly.
Well, honestly, I was really busy that day, doing something. And when I got the phone call, I didn't know Chris was white. I assumed that he was white. So, but I listened carefully to what he was saying, and I have to tell you that it was quite surreal. I didn't know which way I should take it. Should I be angry and verbally express that? Or should I be calm and willing to listen more to what he had said? But I remembered what my father said and how calm he was when he found out that he was in the study and had been used like that. And seeing the pain and the dismay in his eyes. And I asked him a couple of days after he found out definitely that he was one of the men in the study. I asked him how he felt about that. And with his calmness, as always, but with a lot of convictions, he said, I can't do anything about what has happened to me and all of those other men in the study, but it's up to you all to make sure that nothing like this happens again. So here was an opportunity with Chris coming forward, being honest, admitting a wrong that had been done, and I knowing that he personally and the people surrounding him and his staff personally had nothing to do with it. And then he apologizing for what the fund had done, and asking in so many words, but not directly, for forgiveness. And it meant a lot for when, you know, when someone come and apologize and ask for and admit their wrongdoing and ask for forgiveness. And then I think my faith, and both Chris and I are Catholics, and we believe in that confession, you know, going and asking for forgiveness, that came into the place. But at the beginning, it was quite surreal, and I really didn't know, you know, how to go forward. But then I remembered, as I said, my father's words. So I said, here's an opportunity. Here's an opportunity to show that you can come together for wrongdoings. You can come together with the person who have wronged you to make it better so that it doesn't happen again to others. So that to me was very powerful. And then Chris came across as a very honest person, and his conversation led me to believe that I could trust what he was telling me and what I was asking of him to do as far as moving forward, not past, but moving forward from where we were. That encouraged me a great deal. So I appreciate Chris coming forward, and I think it can be used in a lot of other situations. And I do hope that more people who have wronged, especially the organizations and the companies and the health system, will come forward and say, look, this did happen, but we cannot move forward unless we admit it and we change it. And that's another thing, is with action. It's more than just words and talk. You have to have some actions with it. And that's the only way we're going to build trustworthiness. And you can't get trust unless you have trustworthiness. So that's very important with that.
Thank
So
you.
I enjoyed the conversation, but then after I finished with the conversation, I said, now that what happened? And I said, what happened? And then of course I had to reach out to others and share, you know, on the board. I said, I just received this phone call, and it was sort of strange, but we'll see where it goes from here. So that's.
And where did it go, Chris? I mean, it went some places that you weren't anticipating, I understand from our conversation.
But once it was clear that Lillie wasn't going to smack me down, I wasn't asking for forgiveness, but I was hoping I wasn't going to get beat up. We knew that we wanted to put this in writing, so that was an important trust building step. But it was things like, Lillie, please share this with your board. And Lillie would say things like, I'll share with my board. I can't, you know, I'm going to ask them not to share with others, but I can't guarantee. And I say, yes, I understand, you know, and so it's how we build the trust. I think the biggest kind of the leap was when we're talking to the board, and out of the blue, Lillie said, I think you need a public apology ceremony, and I think it ought to be at Tuskegee. And this is a virtual meeting, so members from Milbank weren't together. It was the vice chair and myself, but we kind of knew it. We said, okay, let's do it. You know, and I think that was the unexpected turn, and everything that Lillie, the onus was on us. And so everything that Lillie would ask us to do, so long as it seemed reasonable, meet with the board, meet with the members. That was our responsibility to say yes to that. So yeah, it was when we got to talking about dollars and how that would work, it was, Lillie was acting in ways that her father felt would reflect well on him or well on her. And I think we all need a little bit of that sense of what's the right thing to do when you're interacting with one another. So how do you treat one another the way you'd like to be treated? And yeah, I mean, that's how you build up that kind of trust.
Absolutely. So Chris and Lillie, I did see that there were a couple of questions that we'd like to pose to you for answers. I just wanted to say within our organization here at ABIMF, Daniel and I have had some interesting conversations as well. And I know I shared it with both you and Lillie, Chris, I shared with Daniel, I am a Black female. I've been in corporate America for more than 35 years. And I am not trying to polish over anything. I loved being asked to do this interview, but I also made it very clear that I was not going to be used in that way. And I know, Lillie, that you had to feel a little bit of that because you represent, like you said earlier, not only your father, but you represent a whole community, as do I. And I just wanted to thank you both for your incredible generosity of just being honest and vulnerable in this whole conversation. So with that, I'd like to turn it over to Daniel and to some questions that we're seeing in the chat. Daniel?
Thank you. I just want to comment on, Chris had a lot of courage, but Lillie had a lot of grace, and to forgive showed a lot of grace and humanity. And to me, that was the most important part of this, that the grace and humanity that came out from Lillie was extraordinary. I'm going to call on people. Ron Wyatt had an excellent question. You want to come forth, Ron, with your question?
Sure, I will. And thank you all so much. This is a really moving session. So really, thank you for doing this. My question has to do with the continued, and Ms. Head, you alluded to this as I was typing it in. We continue to support in many ways and resist change when it comes to these topics. Back in 2020, the US Congress asked 4 medical societies to look at how they are approaching race-based clinical algorithms. And if we go back to the 1600s, then these algorithms originated back that far. They're still taught in medical schools. They're still taught in nursing schools. So my concern and caution is that we continue to support race-based clinical decision-making, and the result is the continuation of harm and suffering and premature death of Black and brown people. And I will be more provocative and say that in this country, being Black or brown is an independent risk factor for premature death. So then how do we abolish race-based clinical algorithms? And as we speak, some of these major societies are already pushing back, saying that this is too much, it's too soon, we're still dealing with COVID. Can we wait? We cannot wait. So I'm just asking for a reaction to that, to say, it took us 50 years to get to this organization saying we are sorry and we mean it. So then beyond this, what are the actions, back to your point again, Ms. Head, what are those actions gonna be to abolish race-based clinical decision-making and accept the fact that it's always been rooted in the white supremacy that exists today in organized medicine in the United States? So I'm open to anybody's reaction to that. We can't apologize without doing something, without going out, putting the Milbank name and the ABIMF name on the line to say, we will stop all of this. We are committed to it and we will not give up.
Lillie, you want to react first and then Chris?
Thank you, Mr. Wyatt. I agree with that. And that's one of the reasons why Voices for Our Fathers is so, I guess, passionate about using our platform at this particular time to address that issue and to showcase how racism has played a part in our healthcare system. And we did not, when we were organized, we did not even think that we would be in a position like this. But this is one of the things that we want to do. And our partnership with Chris, when we talked about what we will do and the action we will do, that's part of our partnership, is we will address racism in the system and how we can get rid of systemic racism and what we will do about it. I will also say that with the voices, we are also working with medical students, and we are talking to them about how those embedded ideas and theories and practices and protocols have put into place that were based on racism and the system and all of the ways in which Blacks were treated over the years. And not only the Blacks, but we want also anyone who has not been treated fairly and those who have been underserved with that. So yes, we are really trying to use our voices at this particular time to showcase the racism in the health system and hopefully improve it.
Let me quickly add, I'm a native son. I was born in Selma. I'm in South Alabama right now. We call it LA. So thank you so much for this.
Yeah, well, thank you. And I can also say that we invite anyone who support or will advocate for our mission to join us. And you can go to our website to join us and to become a part of our membership. We are looking for people who will help to champion the cause, because it's going to take a lot of voices to change what has happened. And in so doing, and I think the thing that brought Chris and I together was to look at knowing the past, but also preparing for the future and securing the future. And we know we can't stay in that same place that we were with being with hatred and trauma. We have to move from that to make things change. So we're looking for people to come aboard with us to make that change and to speak out, because we don't have our board and our descendants so far. We don't have all of the expertise and the inroads and the knowledge to do that. So we welcome anyone to join us. Our website is voicesforfathers.org. And my phone number is on that website as well. So you can call me personally too. But
Right.
That's what we want to do.
Thank you, Lillie. Chris, you want to add to that? What's the
Well, it's
role of
hard to-
Milbank?
Yeah, it's hard to follow up. I guess, Ron White, what I would say is, as a white person, I appreciate Pamela for putting race out there, because it makes it easier to have this is part of the conversation. I think particularly white people have to be more comfortable talking about it and taking that risk that you talked about at the beginning, because at least this white person for a long time wanted to do the "we are all brothers and sisters" kind of thing and not pretend that there are differences. And so I think, to get to your clinical algorithm question, Dr. White, I think part of, I would walk around when people, I used as a talking point, oh my gosh, Black people are dying at over twice the rate from COVID as white people. We've got it. If you want an evidence of systemic racism, there it is. And then to use the language that you just used, an expert in quality measurement says, why are we comparing the Black people to white people? That is a supremacist way of framing it. And I was really challenged by that. And I said to him, okay, what's the comparator? And I think, and he said, well, maybe we've got to use other countries, compare us to Australia or something like that. And I think, frankly, we collectively need to think about how we talk about race and how we talk about race differences. When is it helpful and when is it not? It's certainly not helpful in clinical algorithms. Is it useful in terms of outcomes if we're trying to draw attention to problems? I don't know. But I think, and even as we have that kind of intellectual conversation, we have to keep rooting it in the experience of harm. That's the power of what Lily's talking about, the power of what Pamela's talking about. And so we have to root these conceptual conversations around how racism is perpetuated with real stories of how people are hurt by it. I think that's why we find the examples of police violence on young Black men in particular so compelling, because it makes it so real for these larger issues that we're wrestling with.
Thank you. Lorna Lynn had a question about what about the women that might have been affected by the men. Do you want to take that, Lillie? What was the issues around women that were infected by men, and how were they treated post-study?
Of the women and the children and grandchildren became, after the study was exposed and people were tested, became a part of a healthcare plan, and they were given the proper medical treatment that they deserved. I want to back up because there's a lot of history before the study, even before the study began, but and that's a conversation for another day. But the women, when they were testing the men to see if they had syphilis, they were also testing the women, and they were also testing the children. And there's data that shows how many women had syphilis and how many children had syphilis. We don't know what they did with those women and how they were treated, which is a tragedy. And we need to find out what, if anything, happened to them. I also want to make clear that we understand that 1 in 10 Americans in the United States during that period of time had syphilis. 1 in 10. So you see that the syphilis was rampant. And the question would be, then why Tuskegee? So, and that's another discussion for another day. So it's important that we understand that there's a lot still to be known about the study and what came out and how so many people were infected. But as far as the research that I have seen and what I have read about the study, the women were not treated during that time. Now, perhaps when penicillin came out, the women might have gotten treatment and the children might have gotten treatment, but I have no documentation for that. And only thing I could do is with hope that they did get some type of treatment. I must say that we have had descendants at our meetings, in our healing sessions, to voice their anger over how they had been treated and how people had related to them because they had contracted syphilis from their fathers, or it had been passed on down to them from their mothers. So it's really a very damning, some of the stories are very damning and very, very heartbreaking stories to listen to when you know something could have been done about it. That's the tragedy of it all. Something could have been done, but was chose not to.